Okay, so have you ever noticed how some blood draws are like one and done, but then other times it's like they're on a quest for the perfect vein?
Mm-hmm.
It's like, what is the deal with that? So today we're doing a deep dive on, how to get the cleanest blood samples possible, minimizing, those pesky little ruptured blood cells.
Right.
Hemolysis.
Yeah,
It can really throw off test results.
it can.
We're going to be talking about all sorts of things. The physics of needles, the surprising impact of which syringe they choose, even those pneumatic tubes.
Mm.
Those tubes that whoosh the samples around the hospital? We're going to talk about those. Our sources today are blood draws and hemolysis.pdf.
Next blood draw.
Exactly. Research paper on hemolysis associated with pneumatic tube system transport for blood samples.
It's a good one.
Buckle up. It's going to be good.
It's really fascinating, actually, because it really all boils down to pressure. Negative pressure, to be precise.
Okay, so unpack that for me. Negative pressure.
Mm.
It's not just about how hard someone's drawing the blood.
Right. Think of it like a garden hose. If you've got too much suction at one end, the hose might kind of collapse inward, right?
Right.
So in blood vessels, those red blood cells, they can actually get stretched and damaged if the pressure changes too abruptly during the collection.
So it's like this delicate balancing act.
It is. It is a delicate balancing act. And this is where things get really interesting because even subtle factors we might not think about it, but they come into play.
Okay.
So let's talk about Poiseuille's law.
Uh-oh. Physics. Don't worry, I'm here for it.
You don't have to dust off the textbooks or anything.
Okay.
But Poiseuille's law, this highlights how much power the radius of the needle has on pressure.
Okay.
And we're not talking about a small difference. Like even tiny, tiny changes in that needle size have a huge impact.
So bigger isn't always better. It's about finding the right fit for the vein.
Exactly. Finding the right fit, that's what it's all about. It's like, matching the catheter size to the vein size for optimal blood flow. And then on top of that, you've got the Q factor.
Q, like James Bond.
Like James Bond. This is where things get a little,
Dangerous.
not quite dangerous.
Okay.
But this Q stands for volumetric flow rate.
Okay.
And basically, that's just how quickly the blood's being drawn.
Uh-huh.
It's the difference between, gently pouring a glass of water versus turning the faucet on full blast.
So even if you have, like, the perfect needle size, being too aggressive with the syringe can still cause problems.
Exactly. And the ironic thing is that while this is the most controllable factor in the whole process, it often relies on really subjective cues. Like, how many times have you heard flush hard in training?
Right, flush hard.
Yeah.
But hard means different things to different people.
Exactly.
No wonder there's variation.
Exactly. That human element, that's where most of the variability comes in, even though it's the part we have the most control over. And so when those red blood cells, they're subjected to this excessive pressure, we get what's called cavitation.
Cavitation. It sounds kind of like what happens when I eat too much popcorn.
It's similar. It's like those cells are getting stretched and squeezed until they burst, and when they burst, they release their contents. You've got hemoglobin, potassium, LDH, all these things that can really skew the lab result.
Okay, so negative pressure is the enemy.
Mm.
We can't just rely on needle size alone. What else can we do to control this pressure and keep those red blood cells happy?
Well, this might surprise you, but there's a Goldilocks principle when it comes to syringes.
Okay, now you've got me intrigued. Tell me about the syringe situation. What's the deal?
So it's all about finding that sweet spot. Not too big, not too small.
Okay.
Because if the syringe is too large, it's just physically harder to control the suction, right? But, and here's the thing, if it's too small, then there's this temptation to pull back too quickly. And again, that increases the pressure.
Right.
So it's all about being gentle, controlled. Gentle and controlled is the name of the game. And that's where this concept of like the catheter to vein ratio, CVR, comes in.
CVR. That sounds like a fancy sports car.
Almost. It's about finding the right fit, though. You know how we were just talking about finding the right fit?
Right.
This is like finding the right gear. Essentially, what it means is matching the size of the catheter, that's the tube part of the needle, to the size of the vein.
Okay.
And ideally, you want that to be less than 45%. So the catheter shouldn't take up more than 45% of the vein's width.
Okay.
And that allows enough space around it for the blood to kind of flow freely, and it reduces the risk of that negative pressure.
So finding a vein that's big enough,
Mhm.
but not too big, so that the catheter is not creating this vacuum effect. It's like a real-life plumbing puzzle,
Yes.
but with blood.
Exactly. And, there are other factors at play too, like how long that tourniquet is left on. That can have an impact.
You mean that tight band they use to make the veins pop out?
Exactly. Exactly. If that's left on too long, it concentrates the blood, and that can actually end up skewing the results.
Interesting.
Even patient positioning can matter, like
Yeah.
using gravity to help the blood flow towards the needle.
Wow. So many things I never would even considered. It's amazing how much goes into something as simple as a blood draw. So speaking of details, what about actual techniques? Are there specific techniques that can help minimize hemolysis, things that people can, ask their doctor about or, I don't know, even try to do themselves, within reason, of course?
There are, and one that's really interesting is called the pull pause method.
Okay, pull pause. I like it already.
It's as straightforward as it sounds. Basically, what you do is you pull back on the plunger slowly to draw the blood, and then you pause to let the vein kind of refill a little bit before you continue.
So you're giving the vein a little breather.
Exactly. It prevents that constant, strong suction that can be really tough on those red blood cells.
Pull pause. It's so simple, but it's elegant. I'm going to add that to my mental medical file. Pull pause.
Sorry.
What about other things? Like, when they're drawing the blood and they have all those different colored vials, is that just for aesthetics or?
It's not just for show, no. Those colors actually indicate different additives or preservatives that are inside,
Okay.
and they're tailored for specific tests.
Oh.
And here's a tip. Don't shake those vials.
Wait, really? I always see them doing that, like the dramatic shake.
I know it seems counterintuitive,
Yeah.
but shaking can actually damage the blood cells.
Oh, wow.
So gentle inversion is really the key.
Okay.
Just a few times over to mix the blood with the additive.
Okay.
A couple other things, like angling the needle slightly so the blood flows down the side of the vial instead of hitting it with force. That can make a difference. Filling those vials completely, because that minimizes air exposure. That's another good one. And then, of course, just getting those samples to the lab ASAP. Time is of the essence.
Those cells have places to be.
They do. They have things to do. And speaking of getting those samples where they need to go, let's talk about those pneumatic tubes, those ones that whoosh them around the hospital. Friend or foe of clean blood work.
Okay, yes. I've always wondered about those things. They always seemed a little, Willy Wonka to me, but I guess they're super efficient. So what's the verdict? Are they secretly destroying our blood samples as they're, flying through the hospital?
Well, the research is a little bit mixed on that, actually.
Oh.
Some studies have suggested that the rapid acceleration and deceleration, they're in those tubes, they're flying around, right?
Right.
That and just the potential jostling inside can actually lead to increased hemolysis, but then other studies haven't found a significant difference.
Interesting. So it's not like a simple yes or no.
It's not a simple yes or no. It seems to depend on a lot of factors, like the pneumatic tube system's design, how fast the samples are traveling, even just like the maintenance of the system.
So more like an it depends situation.
It depends, and it really highlights the importance of quality control for these systems, which, it makes you wonder what happens to those samples once they actually reach the lab, right? I mean, we've been so focused on the collection part of things. There's a whole other journey that they go on.
That's a really good point. Well, we've been so focused on, just getting the blood drawn. It's like there's this whole other step.
Exactly.
It's like we've uncovered this hidden world within the hospital, this secret life of blood samples.
In a way, we have. It's a complex system.
And it makes you think, what happens after those little vials disappear behind the lab door? Is there anything we as patients can or should be asking about that part of the process?
Oh, it's such a good question. And honestly, I think it's something that gets overlooked a lot. We're so focused on the collection part, finding the vein, minimizing the discomfort. We kind of forget that there's this whole other leg of the journey, and it's just as important for accurate results.
So walk me through it. Once those samples are in the lab, what are some of the potential things that could go wrong, things that could affect the quality of the sample?
Well, just for starters, there's the handling and storage. You know how we were talking about shaking those vials can damage cells? Well, the same kind of thing, like rough handling during processing or even just moving them around the lab.
Yep, okay.
That can introduce errors.
So it's not like they're back there, gently placing them on a velvet pillow and,
Sadly, no.
Yeah.
I mean, that would be great.
That would be ideal.
Yeah.
For our little blood samples.
Right. But then there's also temperature control. Some of those tests, they require those samples to be kept at really specific temperatures.
Oh, okay.
And even slight deviations can throw things off.
So they really are like these little divas, these little vials.
A little bit. And then, of course, time. I mean, some of those blood components are pretty fragile. They start to break down quickly.
Right.
So getting them processed and analyzed within the right time frame, that's huge.
Okay, this is all very eye-opening. I had no idea that so much care and precision went on, like, behind those closed lab doors.
Yeah, it's amazing. And it really speaks to the skill and dedication of those lab professionals because they're working behind the scenes
Right.
to make sure those test results are as accurate as possible.
Absolutely. So what can we as patients do besides, sending good vibes to the lab techs to really advocate for ourselves and make sure that we're getting the best blood work possible?
Awareness is huge. Just knowing that this is a thing, like hemolysis is a thing,
Right.
knowing that it can affect your test results and that there are things that you and your healthcare provider can do to kind of minimize that risk, that's a great place to start.
Right.
But you can also ask your healthcare provider about the lab where they send their blood work. Like, are they known for having really good quality control measures in place?
Oh.
Do they have a pretty quick turnaround time on those results? That kind of thing.
Okay. So not all labs are created equal.
Right. And while you might not be able to control every single step of that process, just being informed, just asking the questions, I think, makes a world of difference.
Love that. Knowledge is power, even when it comes to something like a blood draw.
It really is.
Well, I think we've covered just about everything there is to know. We really did a deep dive on blood draws.
It did.
Any final words of wisdom before we wrap up this episode?
Well, I think if there's one key takeaway, it's this. Those little vials of blood, they might seem small, but they hold so much information about our health, right?
Right.
So it's worth taking the time to understand the process and how we can all play a part in making sure that those samples are treated with care, basically.
Beautifully said. I love that. All right, folks. Remember, knowledge is power. Next time you're getting your blood drawn, don't be afraid to, channel your inner scientist and ask some questions. You might be surprised by what you learn. Until next time, happy learning, everyone.